337 people have been diagnosed as new cases of COVID-19 in Australia. This is a significant reduction since 10 days ago when we reported 747 new cases. But tragically, we've seen another 19 deaths reported in the past 24 hours in Victoria. This is the single highest number of deaths in a single day from COVID-19 in Australia and brings the number of people who have died from COVID-19 in our country to 313. It's only 10 days ago that the number of people who died from COVID-19 in Australia passed 200, and now we've passed 300. This, of course, is an agonising day for the members of the 19 families who have lost a loved one to COVID-19 today. Our thoughts are with those who have lost their lives and with their families and friends and other loved ones. The deaths that we've seen today, of course, reflect the high levels of community transmission which we saw 7 to 10 days ago. As community transmission continues to fall, we hope that we subsequently see a fall in the number of people who pass away. Over the past 24 hours, 322 new cases were reported in Victoria. 14 new cases were reported in New South Wales. One of those cases was overseas acquired, and that person is in hotel quarantine. The other 13 cases are locally acquired. And there's been one new case reported in Queensland, again overseas acquired, and that person is in hotel quarantine. 21,397 people have now been diagnosed with COVID-19 in Australia. There have been 3,152 people diagnosed with COVID-19 in the last 7 days. Over 12,000 people are reported to have recovered from COVID-19 in Australia. Nationwide, we now have 664 people in hospital, both private and public hospitals. That's an additional 5 people hospitalised since yesterday. Among the people in hospital, there are 54 people in intensive care units, which is 4 more than this time yesterday, and 39 people are reported to be on ventilators. And over 4.9 million tests have been carried out right across the country, and thank you to everybody with symptoms who is arranging to get tested to make sure we can bring COVID-19 under control. We are seeing the first promising signs of a sustained reduction in daily numbers of cases, but it is too early to be certain. We need to follow the numbers very closely over the coming week. While it's heartening to see the declining number of cases being reported each day from Victoria, and we've seen that over the past 5 days, while we still have hundreds of cases being reported each day, we will continue to have people admitted to hospital and people becoming gravely unwell. And sadly, some of those people will die. We will also continue to have significant risk of COVID-19 infection affecting senior Australians receiving care in both residential aged care facilities and in their homes. This is the tragedy of COVID-19 and the tragedy of the high numbers which we've seen in Australia over the past few weeks. COVID-19 has been having a devastating effect in several aged care facilities. The people affected are much-loved parents, grandparents and great-grandparents, and the dedicated staff who provide excellent care and support to the residents each day. Even the best-run aged care facilities are susceptible to outbreaks of COVID-19, and this is because you can have staff and visitors to the facility who are infected but who are not showing any symptoms. People can introduce the virus into aged care settings and spread can start to occur before anybody knows that this has started to happen. If an infected staff member has no symptoms, even the stringent screening processes introduced at the front door of the facility may not be able to prevent coronavirus from getting inside. The only absolute way to prevent possible outbreaks of COVID-19 in our aged care facilities is to control community transmission. The Stage 4 restrictions in Melbourne are achieving this control of community transmission across the city. Contact tracing also continues to be essential. We must ensure that every new case of COVID-19 is being followed up every day, and I acknowledge the work of our colleagues in Victoria in ensuring that this happens. But everyone has a role to play in bringing down community transmission and keeping the levels down.